Thank you for tuning in to Mokah Speaks. It's time for a real conversation. Speak your mind, speak your truth. What's up, everybody? Welcome back to another episode of Mokah Speaks podcast. I'm so excited. I got so much to talk about. I done got the scoop on what went down at City Hall last week, Tuesday. I'm going to talk about the mayor and commission meeting because they were actually in meeting until 1 a.m. in the morning, and it went down. Okay, and also they voted against the ADUs, and so we have a housing crisis, and I really want to hear people's feedback on that. So if you're listening online, or later on we're going to create space to where you can maybe call in and give me your feedback, because I want to hear what is the big controversy about these ADUs. Also, I'll give you an update, my weekly justice report. I'll give you an update on what's going on with Nolan Wells, because we got to keep asking questions, but I'm going to give you a quick update on that as well. And I have a special guest with me, Diane Greene. Some of y'all know her in the community for various reasons. I met Diane through my work as an activist. She reached out to our organization because people that is living with sickle cell was being mistreated at different hospitals, wasn't getting the attention that they needed, and that's how we partnered up. So I will go ahead and start the interview. Diane, are you ready?
Yes, I am.
All right, so let's go ahead and begin. First and foremost, why don't you introduce yourself to our listeners and our viewers? Tell them a little bit about you, what you do, and why the work that you do is so important.
Yes, I'm Diane Greene, and I work with people living in recovery, and I also am employed with Advantage Behavioral Crisis Unit. And I got involved with advocacy and politics through my jobs, because I saw people that they was homeless. I met people that had mental illness, and then I met people with substance abuse challenges, and some that have reentry barriers after they get out of jail or incarceration. So that's what brought me to this field that I'm in now, and politics grew naturally from that, and because a lot of the rules and laws are changed through politics, and being an elected official is where I began to study my background and see would I be able to do that, and I did. And what I want to do now is to make sure that the people, they need to go out and start registering to vote, and then you must vote, because without that we could not make these changes. And politics is not about a title or being a political party. It's about being a public servant and being accountable and bringing resources and the community back into the opportunities back into the communities, to let people know that there are resources out here that you can actually get help, and you can recover from whatever you're going through. And they need a hand. They need a helping hand when they're going through these challenges in life.
So let's begin with the timeline. So recently I was on my sabbatical break, and I get a text message from you, and you're like, there is a mother that needs some place to stay. She has kids. Everybody's trying to pull together to put money to help her to get some type of housing. And behind scenes, that's the kind of work that you and I and different advocates in the community do. So why don't you start off by telling us, what do you do day to day, and how do you help people with substance abuse issues?
Yes, we did run into an issue like that, and we do all the time with people coming in. They lose their homes due to mental illness, and a lot of times it go unnoticed, and a lot of people suffering with mental illness and don't even know they have it. And then there are times when we run into unfortunate situations beyond our control. And so that is what happened with this particular lady. So every day I work with people living in recovery. We provide resources to people that need mental illness help, substance abuse problems, and then we do check-in where you can come in and we'll talk with you. What we do is provide a safe space for you if you're challenging whatever you're going through, and we'll set you up. We'll try to get you some resources that you need, and we provide an array of resources. That's why I tell people there is no excuse for you not to get the help. It depends upon you. And I want to thank the people that supported the young lady and her kids a couple of weeks ago. And it's a good feeling to be able to pick up the phone and call people that I know, because I don't think that everything should be put on Facebook. So I was able to call friends that I knew personally, and then they did reach out to help the young lady. And thank God, I appreciate your help out there every time I call you all. Thank you.
So what do you want people to know when someone has a substance abuse issue and they're trying to basically save themselves and get reacclimated to a society? What are the obstacles for them to recover?
Well, sometimes, to be honest with you, sometimes the place, if they get locked up, for one instance, if they get locked up for being just hanging out, and they don't, and people don't understand that they are suffering with mental illness, going to jail is not solving these problems. And what they're doing is just putting a Band-Aid on it, and then they're starting a triple effect at that point, because they cannot get employed at some point when they have an extensive record, and everything just start to fall apart if they don't get the proper help that they need from day one. And that's where people living in recovery, can provide those resources. And then they can also go to Advantage Behavior. They got plenty of resources and help for them also, that they could reach out and get whatever they need to start a second chance.
All right, so you're seeing people impacted by the justice system. You're seeing how people are impacted by poverty, not having enough money, being on the addictions. What was that turning moment that you said, okay, I need to do more. I want to do more, and I'm going to run for office because I'm understanding that some of these policies and the laws is what's causing harm or making it harder for somebody to get reestablished? What was that turning point that you said, this is it, I want to run for office?
Well, that turning point came through me working with people living in recovery, because I do know that a lot of people was running into issues when they'll run to me and say, well, what can we do about this? That don't seem right. That don't seem right. We think our rights are being violated. And so I said then that I could take the stand on that to help the people, to walk with them rather than to walk, I want to walk beside them. Whenever they needed something, I want to walk into the building with them to help them ask these questions and get the answers that they needed. And that's what fueled me to begin to run for this political seat.
And what did you learn when you ran? Because I ran for office too, and you learned the hard way.
Yes, you do.
You know what I mean? You think you're doing it for your community. You have good intentions, then you realize that a lot of people that look like us is not in this space. And even though they say, yeah, we want more black people around, you come up against obstacles. So what was your experience, and what do you think were your obstacles that prevented you from crossing over, because you ran twice?
Yes, I did. And my thing of it is, though, is that, out in my area, it's only 1,200 people in the city limits. So each time I came close, very close each time. And I think that, and then a lot of our people just don't take that important. And I wanted them to understand that, you need to know where your tax dollars are being spent. And you need to be a part of what's going on in your community. That's why I take this to heart. It's because a lot of us is just sitting back thinking things are supposed to just work itself out and solve the problem. Then as soon as we come up against something, then we want to call, and then, but your vote counts. That's why it's important for you to do that. And I learned a lot, and I'm still learning. But I've even had a person to approach me to run for Senate, because there's not enough people in Winterville for me to keep doing what I'm doing. But I'm not going to give up. I'll probably run again for the council seat, or hey, I might run for mayor. It's coming up. So, I'll never give up. That's important, too, not to never get up.
And that's for Winterville, right?
That's for Winterville.
All right. That's interesting, because it's like when you're an advocate or someone that's trying to help people, you just be like, okay, I'm tired of asking. So then you want a seat at the table. But then there's not enough of us that understand, like, we need your support in order for us to make this change to win and cross over. So was that the biggest obstacle you experienced when you were running? Just not a lot of people engaging in voting? Or what was the obstacle that you think prevented you from crossing over and taking that seat?
I just think that a lot of them wasn't engaged into going ahead and registering, because there's still a few others that's not registered to vote in the area. And then, like I said, it's important not only to register, but to go out and vote. But I also want to thank the people that has continuously voted for me during those 2 elections. And if I run again, I'm looking for your vote again, and I want to thank you for that. But we got to push the edge a little more. I just need a few more votes each time. And I just think that, by me staying involved in the community, helping people, and doing what I do, we'll get there. I believe that true-heartedly that we will get there.
Well, that leads me to talk more about the discrimination that you felt was happening around sickle cell. And we began working together on that. And then, because you have family members that's directly impacted, and you also were seeing more than just family members that were impacted by the healthcare system, and a person of color that's having a hard time getting the medication that they need, getting the service that they need. So over the period of time, once we start working together, you took it even a step further. This is 2 years now, and you're still doing work around the sickle cell, and it is so important because a lot of people are dealing with this condition. Can you share with us how this work began with you, advocating for people that's living with sickle cell disease? Because I feel like you had some policy success by even having the doctors do this training, So just talk about where we are today and why you got involved in that.
Well, first of all, I had a conversation with one of my nieces that had suffered with sickle cell all of her life, and we were just having a conversation one day, and she was telling me about she was beginning to feel pain, and that she would have to go in here in the hospital and check in, and then have to fight with the doctor and argue with I said, fight and argue with the doctor? You already heard him? And she said, yeah, because they don't want to give us the medicine that we need when we go over there. And I said, no, that's not right. So what I did, I began to make calls for her, and I began to start advocating for her and the rest of the sickle cell people that reached out to me, and when they still reach out to me now. But my niece, she died back in February, and I really haven't talked about that much since then, but we still behind the scenes advocating. So we were able to get the 2 hospitals involved. They got doctors training in it, and a lot of them really, really enjoyed that because they didn't know the magnitude of the pain that the sickle cell patients be going through here. And there will be times she's asked me to drive her to Augusta because of the treatment that they will be getting here at the emergency rooms at both of the hospitals. So it was just a sad story to have to see someone suffering in the back seat of the car trying to get some relief almost 2 hours away. And so we've been having other discussions. And since her death, we have Dr. Gowdy that's willing to work with the sickle cell patients here in Athens and the surrounding counties. And that's where we're at now. We're working with Dr. Gowdy to help.
Okay, we want to give a call to Dr. Gowdy and let him tune in and give you some feedback. But we'll continue the conversation until we get him on the phone,
Dr. Powell will be discussing what we are trying to do here in the area with Dr. Gowdy.
Okay, all right. I know with your niece, may she rest in peace, because I know that you were seeing where it wasn't just your niece, but multiple people that was dealing with this. Can you just give the audience a description of what it is like so they can understand why advocating around sickle cell disease, what they were experiencing when they went to the hospital, and why it's important for us to continue this conversation?
Well, there have been times in the past, and still do now, some would call me crying in the middle of the night. They was in the emergency room, how they're being treated. They had to wait sometimes hours and hours while they still be in pain and still to no avail. And then when they finally get to be seen, they still don't get the proper medicine that they are needing to ease their pain. I even had several young ladies to call me that they would go to Grady Hospital away to Atlanta. So it's heartfelt to see what they're going through. It's just lack of knowledge, I think a lot of it is. And I'm not going to lie, I know some of it is discrimination is involved in this too, because this disease is a disease of color. And then they are, I don't understand it though. Then they say they have a cure. But the cure costs $2 million. Now, how many of us got $2 million that we can reach on our mattress to get and then to try to help this situation? But on top of that though, we're going to the Capitol to try to see can we get Medicaid to try to cover that like they're doing in some of the other states. So we're really trying to, help the sickle cell patients to ease their pains. Because if they really needed drugs that bad, they can go find them on the streets. They don't have to go sit in the emergency room. But this is a dire need, and it's very, very crucial to them when they're in pain.
When we first began, it was like, is this discrimination? Are they discriminating against African Americans from getting the health care service that they need, especially when you have to drive from Athens to Augusta to get the service that you need? So you still think some of it is lack of knowledge, and then you still think some of it might be discriminatory?
Yes, I do. I think it would always be a disparities between healthcare and with our people of color, because they don't seem to take us serious about what we are experiencing. The only time they do is when the disease or whatever we are going through reaches the other segment of people, and then that is when they seem to want to take a listen at what we are going through then. And so I really do think so. And but with God help and we keep pushing, I think we're going to break some barriers with this too. That I'm so glad and I appreciate you all too, the Georgia Foundation of Sickle Cell, coming in, stepping in to help out in the community, and especially you, Dr. Powell. Your heart is in it, and I want to take the time to thank you for that and for being able to talk to my niece before she passed also. And but she lived to be 62, I think. Wow. So that was good.
Thank you.
Thank you.
All right, we're going to go ahead and take a commercial break, and we will be right back. All right, so let's continue the conversation. I want to switch up a little bit and talk about housing. Did you go to the meeting last week, Tuesday?
No, I didn't make it to the meeting, but I heard about some of the things that was going on there and there.
What did you think about the ADUs? I do want to hear people's different perspective, because I'm just like, they just want to put a kitchen in. And some people say it's not going to address the larger issue, but from my perspective, we need housing. So I would like to hear your perspective, because you deal with this issue as well, when people are reaching out saying we need some place to stay, we need some place to live. Do you think the ADUs would have been a solution or helpful, or were you for it, against it? How do you feel about it?
Well, I think it could have, any housing could help, but the problem is affordability. That's what's happening a lot in the area. And I think during COVID, people was giving, the landlords, a lot of them was giving money to house people, and then the rent went up because they was able to do that, but now things are back to normal, and then the landlords do not want to go back down to where they were. And now they have come accustomed to that. You got people I've seen people actually living in their cars, working a job, good jobs, and they're living out of their cars. So a lot of that is happening. And I think affordability, though, is what we got to concentrate on. And that was one of the things that I was running for in my platform, for my city seat over in Winterville. It's affordable housing. And then, you become, and a lot of people are dealing with mental illness because of housing. And a lot of people don't understand that either. But it plays a part in a lot of things that we do here, that we have to. Then if they're running the homeless people out of the woods, where is your alternative? Because the only thing they're going to do is run to the other part of the county, in those woods. So there must be a solution. We got to sit down and talk about this. Now the ADUs, I think it could have helped a whole lot. But then I was told that you can put a hot plate in there. I don't know how that would just work. So there's some other things that need to be discussed about that, though. I really do believe that.
I mean, they turned that down, and I'm still trying to get all the details. I'm going to have someone come on the show next week that has more extensive knowledge about housing, so we can talk about this. But do you think our local government is doing enough? Because we're out here in the field, because there's two different polarities or perspectives going on. We're out here getting the calls from people that are living in the woods with babies in their cars and all. So you're like, is the government doing enough? And if there was funding for housing, when I refer people to these places, they don't have no money. They're saying they don't, and these are the institutions that got the funding for housing. So I'm like, okay, what are we supposed to do? So honestly, do you think the government is doing enough, whether it's in Winterville or Athens?
Oh, no, I don't think the government is doing enough because they have done a lot of cuts. They've done a lot of cuts that money could have been able to help. But I know personally that Clark County has a lot of properties that could be used for low to moderate income people that just sitting around, and they have some properties I know for a fact that just sitting there, some old duplexes and stuff. And what are they going to do with that? I don't know, because we're having to help put people up in motels when they're come in dire need, like especially mothers with kids, and what they don't realize the long-term effect that it has on people, even the kids, because this is, and then you go back to mental illness. Mm-hmm. I'm telling you, mental illness is serious too, and then people resort to substance abuse, trying to cover up what they're going through, trying to numb the pain. And I just think that they are not doing enough. I really do.
All right. Any final thoughts that you want to share with the people before I dive in and start talking about the news of what went down at City Hall, just giving people some feedback? I'm also going to talk about Georgia Square Mall because I heard they're going to be building apartments or proposing to build apartments. I want to talk about that or give people an update on that. What are your final thoughts before we close out your interview? But you can stay with me and talk about this stuff too. Do you want to tell people where to reach you?
Yes, you can reach me at People Living in Recovery. We relocated to 3701 Atlanta Highway, Suite 35, which was known as the old Pink Building. So we're there. Or you can call me on my personal number. It's 706-988-4061. It's 706-988-4061. And I want people to understand that advocacy is making people invisible visible, because that's what we need to do, and helping turn awareness into meaningful action, not just talking about it. We must be about it. And thank you, Mokah, for having me.
Oh, I love that. That's what we do. We make people that's invisible visible. I love that. Are we going to go to a commercial break, or can I keep going, Walt?
Keep going.
All right. So let's talk about local politics. This is my local news report. So, there was down at City Hall last week until after 1 a.m. I was like, thank God I'm not a commissioner, because I'd have got up and left. I was like, what are y'all talking about? And, so... I'm just saying. So we have to ask, who gets to live here? Who gets to own here? Who gets to own property here? And who is getting pushed out? Athens is facing a housing crisis, but housing isn't just about how many units we build. It's about who can afford those units. It's about whether people who work in Athens can afford to live in Athens. And it's becoming tough. So let's talk about the homelessness. That is an increasing thing, and no one wants to see someone sleeping on the sidewalk. But let me ask you, where are they supposed to go? So Athens Clark County commissioners recently rejected a proposed ordinance that would have prohibited people from sleeping, cooking, or using tents as living accommodations in public spaces. Dozens of residents came to Athens City Hall to oppose that ordinance, and they won. So that was a win for the community. And I kept saying, so why would y'all want to criminalize homeless people? You're going to give them a ticket and really think they're going to come to court. They don't even have an address where you can mail them a notice. So therefore, they're going to miss the court date, and then they're going to jail. So I don't understand this type of thinking. So I am happy that the homeless community are not going to be cited for sleeping on the sidewalk. But we do have to discuss public safety and where are these people going to go? What does Athens Clark County Commission have in mind. Now, the AADM, we proposed an ordinance, a housing ordinance, and we start talking about overlay districts. We also talk about putting a cap on rent. People are like, y'all ain't gonna be able to do that. They don't want to put no cap on rent. But overlay districts is a possibility, and it will be designated areas in each commissioner's district to where they say this is land that the government owned, and this is an area where people, unhoused people, can come out of the elements, whether it's heat or extreme colds. They can come over here and live. They can have a site, whether it's, they have it's like a pod community, or they can put up their tents. But I want to talk about overlay districts some more next week, and that is something I'm going to continue talking about, because we have to talk about solutions instead of criminalizing people for sleeping on the sidewalks. Now, this is kind of scary because I live close by the Georgia Square Mall, and I don't know how I feel about this. I like the first plan, but Athens Clarke County government, I don't know what y'all done did to Georgia Square Mall owners, because they're like, we don't want this contract no more. We don't even want to deal with the government no more. This contract done. Okay, we done. So now let's talk about the Georgia Square Mall property. The Planning Commission is considering a new zoning district for the mall property, and there are concerns that redevelopment could ultimately produce thousands of apartments without all of the retail, service, and amenities that were envisioned in the earlier proposal. And I thought that was a good proposal, because they were going to have like a living assistance for where the old movie theater was at. I believe they were going to put a living assistance home, and then they were going to have some apartments and some businesses and walking trails. So I was like, that sounds like, duality. It sounds pretty cool. But after the developers' discussion in July, they had a meeting at the mall. A lot of people came out. They basically told the public that the public-private partnership with Athens Clarke County is done. It's over. I'm sorry. Wow. And I'm just like, dang, and they have to go back into redevelopment independently, and they're going to have to spend a lot of money. So I know they're probably thinking how they can cut costs and how they can make more money, because they probably lost some money, because I know our business moved out of the mall probably 2 or 3 years now. So they've been sitting on that property for at least 2 years or more. So we must ask, how is the redevelopment at the mall going to benefit this community? Is it going to benefit students, or is it going to benefit residents? Pay attention to what's happening at that mall. We had the Juneteenth event, and when we had a Juneteenth event at the mall, there was so many locals that came out and enjoyed the space, and it was like they had childhood memories at the mall. So I realized, I didn't even know, but I realized the significant role that the mall plays in this community, because it has memories from when people were young, from high school, when the mall was active and open. And so the mall is not just a building, another place. It is a part of this community and the memories and the history. So pay attention to what's happening at the malls. Now, I want to just go ahead and talk about the ADUs real quick, and then I want to get some feedback from Diane, and we're going to close it out real soon. So the mayor and commission, August 4th, they rejected the changes that would have expanded opportunities for accessory dwelling units, ADUs. At first I was saying AUDs, but what's wrong with me? But it's ADUs, while approving regulation and allowing smaller homes. And I'm still trying to understand that. So ADUs can include things like a backyard cottage, garage apartments, small secondary homes. So I'm still trying to understand, they approved smaller homes, but they rejected ADUs. Okay. All right. So ADUs, they can create potential additional housing. They can help. There will be these small little cottages, like I said before, that will be placed in somebody's backyard. It can also help with this increasing property tax, people mortgages are going up. So if you have a small unit that 2 people can live in, some people think that, it's going to be like chaotic. There's going to be multiple units put in the backyard, and they're like, not in my yard, not in my city, not in my neighborhood. But those people that are saying, not in my yard, not in my city, what solution do you have? I would love to hear from you that said you do not want these ADUs, and for Athens Clarke County Mayor and Commission to tell us, okay, if you rejected it, what is the solution? So you're okay with small homes, which takes more money to be built, and then you rejected ADUs. So I just want to understand that. So we have to ask, who is Athens being built for? Is it being built for the people that lived and worked and sacrificed and dedicated their years here? Or 3 years from now, Athens is going to look so different, where the people that lived and worked here can no longer afford to live here because, nobody getting paid more, people losing jobs. So I just want to understand how all of this is going to work out. Now, Miss Diane, you still sit here with me listening to me.
Definitely, yes.
What are your thoughts about some of these things that I'm talking about? And what do you think? Tell me about the mall. What do you think about the mall?
Well, I remember the mall, too, back in the days, because we used to drive up all the way from Greene County to support the mall and buy things. And I think that, that with further studies, I guess they need to really sit down and talk about that more, because it could really still be a great entity for the community of Clark County. And then the ADUs, I'm confused too as to, like you said, how can you you can okay the smaller house but not the ADUs? That's very confusing. But the other thing of it is, with anything else, you have to have rules and guidelines.
Right.
Because things can get out of hand if they're not implemented right in the first place. So that's what I think. They just need to go back to the drawing board and think about these things a little more. But then once you put another dwelling on it, I want people to know now your taxes probably going to go up.
Yeah.
Because that's going to be another part, in Clark County, taxes are not a joke now. So there's other things we got to consider too, though, concerning this.
They didn't even table it. Like, I forgot the name of the group, but I don't even want to mess their name up, but they asked the mayor and commission if they'll table it so they can educate people more. They rejected it. But then they passed another thing to where you can have smaller parking lot sizes, because parking lot sizes was an issue, and so I'm just trying to understand, like, the total rejection of it, but you do make some good points. Not only do you have to worry about your property tax going up, the sewage is a problem. Yes. Even, like, I had an issue, like, over the summer with our sewage, and I'm like, I've just been living in this house for 5 years. Why do I have to deal with a sewage problem? So there is infrastructure and things that we have to think about when we're trying to put in these dwellings, but still, I figured they could have found a middle ground. Create some policies and regulations so people don't be out of control and just doing whatever they want.
Yeah, I think that it need to come back to the table, though, and I'm quite sure that it will. And then there we go again. You have to get out, register to vote, and then you must vote. This is how we change laws, and we got to get people in there that's going to be willing to listen to the people once you get into these offices. So I just think that, you got to get out. Like I said, voting is very important, and I'm going to leave you with that.
All right, so I want to give you a quick update on justice for Nolan Wells. So I've been following this case, and last week I told y'all about people getting arrested for making threats, for threatening witnesses and government agencies. But what about the family? Like, all the arrests were pertaining to a judge, and I believe it's probably the white judge that came out speaking up for her son, and different government agencies, but the family has been getting some serious threats as well, and nobody has been arrested for that, And then I'm also questioning, once again, how many people have died on Horn Island. And what people need to realize, there is territory that is for the more privileged. You have to have a boat to go over to Horn Island, okay? And then no one lives there. It's an uninhabited island for people that have privilege, and they've been going there for years. And I refuse to believe at this point, I've been just trying to just give a neutral news report, but I refuse to believe, after I keep watching and digging and just trying to do more research and watching these interviews, I'm like, so if he drowned, and even if it was by accident, how come nobody saw? So y'all is basically saying y'all left that boy on the island by himself, so you abandoned him. Somebody should be charged with abandonment then. Okay? If y'all want us to believe there was no foul play and he just magically drowned, okay, that means you want us to believe that there was over 30 people on the island and nobody witnessed this young man floating, asking for help out in the water, like, so that means y'all must have left him there. That's my theory, you know. And at the end of the day, somebody, I don't even want to repeat this, but somebody for the comment of the week, I post on my Facebook and I say, give me your feedback. What do you think happened to Nolan Wells? Somebody gonna post they think they sacrificed him. I'm like, why these conspiracy theories? I know there's things that happen, but come on, we gotta stay focused, man. We gotta get to the truth, and we have to keep asking questions. I love watching Nancy Gray. Y'all better watch Nancy because she getting it. Dr. Umar came out and he posed some very good questions as well. And I will continue to watch this case because there's a lot going on in Mississippi. You know, they're saying people is committing suicide and hanging themselves, like black people hanging themselves. I said maybe one off person. I said maybe they did hang themselves, but come on. 2, 3, 4. So a young lady climbed up a tree, put a rope around her neck, and hung herself. Wow. Mississippi, I don't know what's going on, but that's a conversation that we need to continue having. We need to pay attention because whatever is going on in Mississippi, we ain't far from Mississippi, so it's going to be happening in Georgia and everywhere else too. So pay attention to what's going on in your community. Also, I want to remind you that we have a special elections coming up, don't we? We have voting for, what is it, the school board? We have something coming up for the school board. Let me pull it up real quick.
But I'm going to say this about Nolan right quick. But you better be careful, people, young folks, be careful at the people you hang with, your associations. Because he had so many friends.
Best friends.
Oh, best friends, but where they took his phone? I mean, I don't understand, though. What do you call a friend? That's what we must understand with ourselves. Who do we call a friend?
And for the young people, you know, one thing I learned is just because somebody say they're your friend, you can choose your friends. You choose who is your friends, and you put people in category because they said, Nolan said he had 3 best friends, or they're all saying they're Nolan best friend. But you mean to tell me all three of your best friends left you, but they took your phone? Come on, man. Y'all got us, like, what we look like out here? Y'all got to prove to us that Nolan Wells magically drowned and nobody saw, and that they didn't abandon him. It just, man, y'all stop playing with people, man. So let me calm down because I'm just tired of all this. I've been trying to just be calm and just, but y'all be coming on my comment. I have a video that's over 17,000 views on that video, and you should see some of the racist comment on that video, like we should not be asking questions, and I'm just watching and reading, and they think that, oh, this is not race. Yes, it's about race too, because y'all making racist comments when black people keep asking questions. All right, in closing, y'all, let me calm down, let me breathe. Woosah, woosah, woosah. All right, so Athens voters, keep your eyes on local election activity. Qualifying for the Clark County Board of Education District 8 special election begins August 19th. So there is going to be a special election and a seat available for the Board of Education. So stay informed. Know who's running. Make sure you vote because your vote matters. Some people say they don't vote. Well, you know what? If you don't have a seat at the table and you didn't vote, and just deal with whatever you get. That's what I say. Don't be complaining. Don't be complaining. So I am your host, Mokah Jasmine Johnson. I appreciate Diane Greene for being here with me today. Remember to come out to the Classic City Soul Food Fest from 12 to 5 at Union Fair downtown on August 15th. Yes, it's going down, another AADM movement cultural session for the community. So come out. And if you want to follow up with all my episodes, visit mokahspeaks.com. And thank you for joining me for another episode of Mokah Speaks.